Let's debunk 5 myths about your pelvic floor. Myth number 1. The way to find your pelvic floor muscles is to stop your pee. Now, if you want to identify your pelvic floor muscles and find them, yes, you can stop your pee to do that. While you're in the bathroom, while you're in the middle of peeing, you try to stop it. That's fine. But you don't want to get in the habit of doing that because there are 2 reasons. 1, we're sending the wrong signal up to the brain about what your sphincter needs to do in order to void easily, right? So if you're constantly stopping your pee, you're telling your brain to send a signal down to your sphincter to contract instead of relax when you need to pee, and you don't want to do that. You don't want to get in the habit of doing that. And number 2, if you're not emptying your bladder fully because you're constantly stopping your pee, then there could always be a residual which can lead to a UTI. So you want to make sure that you're emptying your bladder fully, you're relaxing your sphincter while you're peeing for most of the time. But if you want to just do that to find your muscles, that's okay. Myth number 2. Leaking a little bit of urine after you've had kids is normal. I'm here to tell you, leaking after you have kids, after you've had 2 kids, 1 kid, 3 kids, is not normal. It's common, but it's not normal. These are muscles just like any other muscles. The muscles in the pelvis can be strengthened. So don't accept that just because you've had kids, you think it's a little normal to leak a little bit. If you leak 1 drop of urine, you're incontinent. If you toot when you cough, laugh, or sneeze, you are incontinent because that is fecal incontinence. And you can strengthen these muscles and not have any of those symptoms. Myth number 3, pelvic floor issues only affect women, or mostly women. That's not true. Men deal with pelvic floor issues too. Men pee when they sneeze. Men get constipated. Men have a lot of issues because of their prostate. Men have post-prostatectomy incontinence. It's just that women tend to seek out help more and report their issues more. Women, I think, are also a little more in tune with their pelvises. But in fact, half my patient population is men, and men deal with these issues too. I think the numbers are higher for women because women seek out help more. Myth number 4, you should only seek out the help of a pelvic physical therapist after you've given birth. You should be working with a pelvic floor physical therapist during pregnancy for sure, because the pelvic floor muscles and your abdominal muscles need to be focused on during pregnancy. You want to have strong muscles to help with postpartum recovery, and you want to have strong abdominals to support the pregnancy and prevent splitting of the abdominal muscles, which is called diastasis or diastasis recti. So focus on pelvic floor strengthening during pregnancy, not just after pregnancy. Myth number 5, painful intercourse is okay. No. Painful intercourse is not okay. There's a reason that it's painful. There could be spasms, there could be trigger points in the muscles, there could be adhesions, there could be scar tissue, and you want to work on all of that because that could be a sign of something bigger going on in the pelvis, and you deserve to have pleasure during intercourse. So painful intercourse, even a little bit, is not okay. So those are 5 myths about the pelvic floor that we just debunked.